Good morning.
Good morning.
My name is Ethan. I'm going to be the nurse taking care of you today.
Oh, Ethan.
Can you tell me what your first and last name is?
Brandon Lynch.
Can you tell me where you are?
I'm in Mercy Hall.
Okay. And when's your date of birth?
5/19/98.
Okay. And who's the president?
Donald Trump.
Very good. And what's today's date?
Today is December 5th.
Let me check your wristband. Alright, very good. I'm just going to wash my hands real quick. Prior to this, we took his vitals. His heart was 80, temperature 98.2, blood pressure was 120/70, pulse oximetry was 98%, respirations were 16. And you are 5'11",
Yes.
and you weigh 150 pounds?
Yes.
Alright, very good. Patient is alert and oriented. He's a 20-year-old male, white Caucasian with pleasant and relaxed facial features. Appears well-nourished, well-groomed, with a strong build, with good posture. And speech is clear and articulate. Alright, first we're going to start with stereognosis and graphesthesia. So you want to sit on the edge of the bed and face me? Close your eyes and put your hands out. Can you tell me what this is?
Coin.
Very good. Alright, say just like that. Tell me what the symbol is that I'm drawing on your hand.
So, figure 8.
Very good. Alright, you can open your eyes. Can you rub the heel on your shin? Rub your right heel on your left shin. Do the same thing on the other side. Very good. Next, I'm going to check your patellar reflex. Very good. Go ahead and stand up for me. Face me. Close your eyes, catch your balance, and stand on one foot. Very good. Alrighty, so from heel to toe, can you walk to the end of the table here? Alright, now walk with your tippy toes back. Very good. Can you walk on your heels? And then walk back normally. Alright, patient has normal gait with no difficulties. Well balanced. Alrighty. Can you stand right over here for me? Bend down and touch your toes. It's going to check for any abnormalities in the structure of the spine. Slowly stand back up. Very good. No deformity or curvature, full extension. Can you bend side to side? Lateral bending is normal. With rotation, patient has full range of motion, no pain or crepitation. You can go ahead and sit back down on the bed. Next, I'm going to inspect your head and face. Frontal and maxillary sinuses. No swelling or tenderness. Neurocephalic with no lesions, lumps, or scaling. Can you wrinkle your forehead? Pucker your lips. Puff your cheeks. Smile. Bare your teeth. And close your eyes tight. Very good. That was check for cranial nerve 7. Shows it is intact and functioning normally. Next, we're going to check your jaw. Open and close. Alright, open and close. No involuntary movements or weakness. Can you put your hands out like this? Push up. Alright, do the same thing with your legs. Push up. Alright, no involuntary movements or weakness there. Next, we're going to check your eyes. So come over here and stand right here and face the chart. Read from top to bottom, covering your right eye.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D D E F P O T E C.
Very good. Cover your right eye. Since you're able to read all the way down to 20/20, go ahead and read this.
DEFPOTEC.
All right, and don't cover any eyes? One more time.
DEFPOTEC.
All right. Patient has 20/20 vision, indicating that he can see clearly from 20 feet away, which should normally be seen at that distance. You can come back and sit down on the bed. All right, first I'm going to do the confrontation test. Check the visual fields by confrontation. This will detect any abnormalities with cranial nerve 2. Go ahead and cover your right eye. Tell me when you can see my finger.
See it. I can see it. I can see it. I can see it. I can see it.
All right, other eye.
See it. See it. See it. See it. See it.
Very good. Alrighty, can you, next we're going to do the cardinal fields of gauges to check for cranial nerve 3, 4, and 6. Look right at my pen. Alright, normal functioning was cranial nerves. Alright, follow my pen one more time. Next we're going to do accommodation. Once you follow it all the way in, and then as soon as we're done, look at the wall that's farthest away. Alright, pupils dilated, accommodation present. Next I'm going to check your pupils. Alright. Fantastic. Pupils are equal, round, and reactive to light. Should I get a closer look at your eyes? I'm going to pull this down. Sclera is white, conjunctiva is clear in both eyes. Eyebrows symmetrical bilaterally. Eyelids, no swelling, redness, lesions, and are equal bilaterally. Next, we're going to check your ears. Just going to inspect the external ear, check behind the ear for any lesions or redness. Very good. Next, I'm just going to palpate them. I'm going to touch the tragus to see if there's any sensitivity or tenderness. How's that feel? Feels okay?
Yes.
All right, next we're going to take a closer look with the otoscope. I'm going to grab the pinna, pull it up and back because he's an adult. All right, tympanic membrane is pearly gray, canals are clear, no redness, swelling, or discharge. Have you ever had any ear infections?
No.
Same thing on this side, canals are clear, tympanic membrane is pearly gray, no redness, swelling, discharge. All right, next we're going to do the whisper test to check for your hearing. I'm just going to say 3 words and I want you to repeat them.
Dog. Dog. Cat. Cat.
House.
House.
Same thing on this side.
Hand. Finger. Watch.
Very good. Next we're going to do the Weber and Rhine test. Basically going to bang this against my hand so it makes a vibration sound. I'm going to hold it equal bilaterally between both ears. And I'll ask him to tell me when he can't hear it anymore. And I'm going to do it on both ears like this.
I can hear it. No, I can't. Can't hear it anymore. Can't hear it anymore.
Very good. That was a check for the normal functioning of cranial nerve 8. As we can see, cranial nerve 8 is functioning normally and is intact. Next, I'm going to inspect the nose. Just going to look at it. Symmetric. No skin lesions or inflammation. No deformities. Palpate, check for tenderness. Does that hurt?
No.
Alright. Can you look straight up for me? I'm gonna take a closer look in here. Septum is midline with no perforations. Can you look at me? Cover one nostril and breathe out. Other side. All right, nares are patent and with no obstruction. Next, we're going to check your smell. Test the functioning of cranial nerve 1. Can you, do you have any allergies? All right. Tell me what this smells like.
Smells like coffee.
Yes, it does. Alrighty. Cranial nerve 1 is functioning and intact. Next, I'm going to check your mouth and throat. Get this right here. Could you open your mouth for me? Say ah. Gingiva mucosa pink. Gag reflex is present. No lesions, bleeding. Tongue was symmetric and protrudes midline. Tonsils are graded +1. Uvula rises on phonation. The gag reflex, testing for gag reflex is to check for normal functioning of cranial nerve 9 and 10. Both were functioning normally. Next, we're going to inspect the neck. Neck is symmetrical. No masses, lumps, lesions, or striae. Can you shrug your shoulders? So, shrugging the shoulders there was a test for cranial nerve 11. As we can see, normally functioning normally. Can you touch your chin to your chest? And from side to side, touch your ear to your shoulder. Very good. Normal range of motion. Motion is smooth and supple. Next, we're going to check your lymph nodes and palpate the lymph nodes. Alrighty, so we had some technical difficulties. Our camera just cut out randomly. So I'm going to start at the lymph nodes again. I'm going to palpate the lymph nodes. Start preauricular, postauricular, occipital, submental, submandibular, jugular-digastric, superficial cervical, posterior cervical, and supraclavicular. Alright. No lymphadenopathy, masses, or tenderness. Next, I'm going to palpate the trachea, make sure it's midline. Alright, trachea is midline. Next, I'm going to palpate for the thyroid. Normally, thyroid is not palpable. Not palpable. Next, I'm going to check his carotid pulse, and then I'm going to check for bruise. Pulse is graded 2+, bilaterally. So I'm going to check for bruise. Bruise indicate turbulent blood flow, which means there could be an occlusion in the carotid arteries. No bruise present. Alright, next we're going to do cardiac. So you go ahead and lay back on the bed for me. Pull your gown down. Normally we'd have a curtain, but seeing as this is not an actual hospital, we don't have that luxury. Alright, so first, I'm going to palpate the apical pulse. Start midclavicular, go down 5 intercostal spaces. It's 1, it's 2, 3, 4, 5. No abnormal pulsations, heaves, or thrills. Next, I'm going to auscultate the aortic, pulmonic, tricuspid, and mitral valves. I'm going to use both the bell and diaphragm. It's aortic. Pulmonic. Tricuspid. And mitral. S1 and S2 are present, no S3, S4, or murmurs. Next, I'm going to locate all of his pulses. Temporal, carotids, brachial, radial, femoral. We got in there more. Cross your legs for me. Popliteal. Dorsalis pedis. And posterior tibialis. All pulses are present. Graded 2 plus. Next, I'm going to check the capillary refill. Put your hands out like this. Alrighty, fantastic. No presence of cyanosis. Capillary refill is less than 2 seconds. Lastly, I'm going to check for edema. Do this by providing pressure to the leg. No edema present. Alrighty, next we're going to check respiratory. Take some normal breaths for me. One more time. Unpalpate. Very good. Respirations are relaxed, automatic, effortless, regular, and even. On palpation, patient has symmetrical chest expansions. Next, I'm going to use tactile thermometer to check for any consolidation in the lungs. Say 99.
99. 99. 99. 99.
Very good. One more time.
99. 99. 99. 99. 99.
Very good. I was able to feel vibrations, which means there was no consolidation. Next, I'm going to listen. I want you to repeat 99 again.
99. 99. 99. 99. 99. 99.
Very good. Same thing on the front.
99. 99. 99. 99. 99. 99.
Next, I'm just going to listen to your breath sounds. Make sure everything's clear and that there are no abnormal breath sounds. to start at the top here. Take a deep breath. The adventitious breath sounds present. We're going to do the same thing to the front. I'm going to start at the top. Listen. Bronchial, bronchiovesicular, and vesicular. And then I'm going to come back up and check the bases. Read it. And one more time. Adventitious sounds present. Go ahead and lay back onto the bed for me. Next, I'm going to check the abdomen. Just going to pull. Yeah. Grab the chair. Abdomen is symmetrical, skin flat, symmetrical, skin is smooth, no lesions or striae. We'll locate and auscultate each of the 4 quadrants. In this section, normally we would start with auscultation because if you palpate or percuss beforehand, you might hear sounds that you normally wouldn't. This is the right upper quadrant, right lower quadrant, left lower quadrant, and left upper quadrant. We're going to start in the right lower quadrant, because that's where abdominal sounds are usually heard. When was the last time you ate?
This morning,
What did you eat?
I had a bagel.
Vowel sounds are present and normal active. Next, I'm going to percuss. Each quadrant, locate the liver and check for splenic dullness. Try to percuss the spleen here. No splenic dullness noted. Liver span, 1.5 centimeters beneath costal border, and spans approximately 6 centimeters. Next, I'm going to palpate and check for pain and tenderness. Does that hurt? All right, no tenderness noted. On inspection of his skin, color is pink, warm. No rashes, lesions, ulcers, or moisture. Skin turgor indicates no dehydration due to the absence of tenting. All right, Brandon, we're all done. Thanks for being my patient today.
Thank you very much.